So here at the Myopia Conference at Aston University, we've heard from eminent people such as Noel Brennan talk about the tsunami of myopia that's going to engulf the world. And rather than just consider this in terms of a refractive correction, which we can obtain by glasses, contact lenses, or refractive surgery, we're hearing about the real issues regarding sight-threatening conditions throughout one's life if you are myopic. A myopic eye being an extended eye, a stretched eye. This tissue stretching brings with it risks associated with not only things like retinal detachment, but also maculopathies, those conditions of the eyes that are very difficult to treat. In actual fact, very often lead to blindness and sight-threatening complications that will affect people's vision and activities for the rest of their lives. So we've seen that, we've heard about it. So why is there a lack of change within not only our professional bodies but also regulatory bodies? And we're seeing those early biomarkers to indicate this expansion of myopia, and the risks and the implications of that are going to be seen not only in the next few years but really decades to come. As the eye strengthens or stiffens a little bit, we're seeing these stretching of the eye impacting on the macula, the back of the eye, and the retinal tissue, and these damages will occur. Okay, it's inevitable. We've seen evidence that not only are these damages going to occur, this damaging effect occur, but also that we have tools today that we can use to limit that damage. We may not be able to stop myopia, although there have been certain individuals, so those early adopters, that would suggest that we actually have strategies that can reverse that myopia just somewhat. But even if we slow that myopia, slow it by 50% or even 1 diopter, we can actually limit the damage associated with the pathogenesis of myopia. So what do we need to do? Well, as a profession, we need really to start thinking about myopia not as just a refractive correction that can be obtained with glasses, contact lenses, or laser eye surgery, but actually a pathological condition that can lead and will lead to significant levels of blindness in the world. In the Far East, it's already becoming the #1 indicator in terms of sight-threatening conditions, the most likely cause. In the Western world, we're seeing that doubling of level of myopia and really exponential changes within the levels of high myopia. These very stretched eyes that if you have an eye that's stretched beyond 30 millimeters in terms of length of the eye, you have a 90% chance of a sight-threatening complication at some point within your life. But we're not doing anything.